Hello everyone, it's Ashley with Amare, owner and founder of Amare Healing Arts, Plastic Surgery Recovery Center, and Holistic Clinic, specializing in manual lymphatic drainage. We have 2 locations in New Jersey, Highland Park and Elizabeth, and I also offer virtual consults. If you're not in New Jersey but still need help with your recovery, you can give the office a call at 732-841-0142 to set up your sessions. We have our post-op shop where we offer post-op supplies like lipofoams and BBL pillows, and I teach you guys how to use those products with the videos that we have on our product page. That's amarepostopshop.com. We also have our online courses where I teach you guys what massages you would need after plastic surgery, when to get your massages, who to get them from, what the lymphatic system is, what lymphatic massages actually are, and all the research that you would need on your post-op massages and finding a lymphatic therapist. All of these links are in our bio as well as in the description boxes, so you guys can go and check that out. I will see you guys soon. Ashley with Amare. Bye. Ashley with Amare. So we're going to talk about something. We're going to start with this. After lipo, or even before lipo, one of the most common procedures that everybody gets is a tummy tuck, right? Everybody's always afraid, like, oh, I need a tummy tuck, blah, 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 blah. Okay, why? Loose skin. Today we're talking about loose skin. So there are some alternatives if you don't need a tummy tuck for loose skin. But let's start with this. How do you know? How do you know if you need a tummy tuck or if you just have loose skin or if they can even do a tummy tuck? Because a lot of doctors, if you don't have enough skin, will not perform a tummy tuck on you because there's not enough there. So Sonobello does a skin removal, not a tummy tuck. They are 2 very different things. Skin removal is where you don't have to touch the belly button. All your loose skin is down here. Tummy tuck is where your whole stomach is loose and they have to cut around the belly button. The belly button is a stalk, so it stays inside your body. It stays attached. They cut the skin around it and then they pull the skin down. So now that hole is now down here. So once they pull the skin down, they have to make a new hole and stitch that stalk that's sticking out of your body to the new skin that they've just pulled down, right? So that's a tummy tuck. Tummy tucks often come with muscle repairs or ab repairs, which is where if your abs are separated sometimes from having kids or weight gain, or if you have a hernia, which is basically a tear in the muscle that they have to repair, they have internal stitches, so they stitch up your muscles like a corset almost. And then they pull the skin back down and stitch down here. So you have twice as much work. That's like a full tummy tuck with a muscle repair. A regular tummy tuck without a muscle repair is just where they cut the belly button skin around it, pull the skin down, pull all the skin here, and stitch it back together nice and tight. Skin removal is when it's just the lower abdomen, just a little bit of skin on the bottom, and they just cut that off and then stitch it. And that's it. Okay, so those are like the 3 phases pretty much. So when you're talking about, do I need a tummy tuck? Well, let's look at where your skin is. So why does this happen to begin with, right? So we have stretch marks. We have lots of loose skin. Skin is like elastic, basically. Think about like a rubber band. When you pull that rubber band too far and it snaps, there is no putting it back together. You ever try to fix a rubber band after it's broken? You can tie it and it's still gonna snap. It's impossible. So your skin is the same way. Once the elastin is broken, it's broken. So you have to now cut it and pull it back down. So a couple things we can do with this. Now, there are some cases, which we're going to talk about today, where you don't have enough loose skin, which means you still have pretty good elasticity, but you don't have enough loose skin to cut and do a tummy tuck. So, how do we know? Usually, doctors say that if you can grab like a handful of your skin, like if you can like really pull it away from your body, you need a tummy tuck. If it's just loose on there, that's a different story. They can't tummy tuck that because it's still kind of attached. So there's a lot of times after lipo, if you've had a lot of lipo, if you've had a lot of sculpting, if you've had weight loss, where your skin is loose, where your skin looks like wrinkly, but it's still like in one patch. It's not like a whole thing that you can grab and pull away from your body. So in those cases, we have tons of stuff that we can do to get that skin to snap back and for you to be flat and tight. So the biggest thing is derma rolling. Now, on our Instagram, I do have a lot of before and afters, if you guys search through it, of loose skin, where it shows you that puckering of the skin, where it's like wrinkly in one area, usually like the middle, or like at the bottom, where it's not enough to do a tummy tuck. Because it's still, there's still tissue there, it's still attached, so it can't be cut out or excised. So with that, there are a couple things that you can do. And this happens with cool sculpting too. Any procedure where you're removing fat, your skin is going to bounce back. Now, with a couple procedures, they do things like J-plasma, body tight, Vaser lipo also has a skin tightening component. So with a lot of lipo treatments that you get, or a lot of surgeries that you get, they do offer some sort of skin tightening to make sure everything heals at the same time and snaps back, especially if you are going to have a little bit of loose skin. One of the main things I ask you guys in your sessions after lipo, if I notice it with the swelling, is did your doctor talk to you about loose skin? Two common areas that get a lot of loose skin is when you do lipo under the arms, like right in here, because when you take the fat out, the skin is just hanging. So there's two things you can do for that. Again, something like J-plasma or body tight or any of those things does help the skin snap back, and I'll tell you why in a second. And then of course like the lower abdomen area where you get a lot of lipo procedures done. So let's start with J-plasma. Let's start with the surgery skin correcty things. So J-plasma is basically the lipo cannula, the lipo thing that they use to take the fat out. Instead of a needle, like a cannula, it's a bulb on top. And that bulb uses radio frequency, ultraviolet light, tons of different methods that they use. And they go back in the pathway of where they did the lipo, and that stimulates collagen and it helps the skin snap back. So that's a little more invasive, and that's the same thing kind of like that's done with the lipo, because it's while you're in the surgery that's taken care of. So there are methods like J-plasma. Vaser lipo has that component to it that uses the frequency and stuff like that to help tighten the skin. And then things like body tight, and there are a couple other procedures out there that do that. But if we've already done lipo and we're not going that route and we want to deal with the loose skin post surgery, so post lipo, couple things we can do. Yes, there are those body tightening creams and all of that stuff, but that's if your skin is healthy enough and strong enough to absorb and bounce back. So when we talk about skin after lipo like that, that's puckery, that's an area of skin where the elastin is all broken, but everything around it is still healthy and the tissue underneath is still healthy. So one of the biggest things that I have found that has worked, there are a couple things, but we're gonna go with the biggest one, derma rolling. Derma means skin, rolling is rolling. Derma rolling. So I derma roll my face. What is derma rolling? It's also microneedling. It's kind of the same thing. It's this little device here. It's literally plastic. And it's got, I don't know if you can see this. There you go. Tons of little needles. Now, this does not hurt. I do this once a week. This does not hurt. Disclaimers with derma rolling. Yes, these are needles. You need to clean them with alcohol before and after every use. You need to clean them with soap and water before and after every use. When you are using this, you have to make sure you wash your face or your body first so you are disinfected. This is a needle device. You need to be taking care of this, first of all. Second of all, if you are looking into derma rolling, there are tons of videos out there. At the bottom of this IGTV, I am going to put the link to the article that I really, really love because it's super concise, as well as a couple little disclaimers on there about this. I use this once a week. Another big thing about derma rolling, it is not meant to be done frequently. It's meant to be done anywhere from once a week to once a month, depending on how big the needles are. So what does this do? What is this thing? Okay, so basically microneedling, derma rolling, same thing. It is to be done by a professional if you are doing it for scar treatment, if you're doing it for stretch mark treatment, body rolling, things like that. There are different sizes of the needles. This is a 0.5, I think. Yeah, this is a 0.5. 1.5 is used for the body. It's a bigger roller, and it's longer needles and thicker needles. So for something like that, you're gonna wanna try to go to a professional for. Find a dermatologist, find an esthetician, find somebody that's gonna do that for you. So that's what this looks like. What does it do? So it basically, the needles go in, yeah, it's 0.5 millimeter. It says it right there. This is used for my face, nowhere else. And you don't want to use the same roller on different areas of your body. Pick one and stick with that so it's clean and you're keeping it that way. Basically, the needles roll over your skin. They don't puncture, you don't bleed unless you have scar tissue and you're doing it in a dermatology's office. That's not how that works. And it's not like a pricking, stabbing feeling. That's not how that works. But it breaks the skin so that it heals and rebuilds more collagen. Now, how does that work? Well, we know your body needs time to heal, right? Which is why you space out your derma rolling sessions. And also, you're puncturing the skin. So you're not like doing this for like an hour. It's maybe 10 minutes, maybe. If you're doing an area of your body, same thing. Maybe 10 to 20 to 30 minutes. But if you're doing an area for skin tightening, this is just, I'm going to talk about the face first, but if you're doing an area for skin tightening, for stretch marks, for loose skin, you need to seek out a professional. I'm not saying that you can't do it at home. There are tons of YouTube videos that tell you you can do it at home. That's fine. But if you're talking about post-op skin repair, if you're talking about loose skin like that, please find yourself a professional. One, your results are going to be way better, 1,000,000 times better. Two, it's going to be a fuck ton safer because you have somebody who's a professional that's doing it, that is taking the proper precautions. When I got this, it was sealed in a medical packing. It was vacuum sealed and everything was sterile. So I know that in the dermatologist's office, they dispose these after they use them. So they're not cleaning them and reusing them. They're hygienic, they're cleaned, they're brand new, they're medically sealed. So please find a professional. Don't do this at home yourself, especially for the body. When you're talking about the face, that's something you can do regularly at home. So again, it's small, it's 5 to 10 minutes, and that's it. But again, super, super big disclaimer, please find a professional to do your body derma rolling because it is bigger needles, it is a bigger area, and you want to have a professional doing that. Okay, anyway, back to why this works. So these needles puncture your skin, but not just your skin, they puncture your tissue. And they cause little breakages in the tissue, so they break up any like acne scars, scar tissue, whatever you got on there. And your body then rebuilds that area and rebuilds the tissue and rebuilds with the blood and rebuilds with the lymph and the white blood cells. So you're stimulating new growth. But again, that means it's not to be done frequently because think about if you have a scab. Right? Even if you just get a little scratch, right? Let's just say like you got like a little, paper cut or whatever. That paper cut is going to take about 3 or 4 days to heal. It's going to scab up. Let's say it's like a minor scrape, right? It's going to scab up, and this is minor, so we're talking about face derma rolling here. It's going to scab, and then it needs to heal underneath, and then the scab is going to get dry, and the scab is going to fall off. And then you're going to have like maybe a little scar, or the skin is just going to like look a little weird and still be a little tender. And then maybe after like a week or two, it's gone, it never happened, that was the end of it. Derma rolling is the same thing. You are actively breaking apart your tissue and your skin. So with this, I use this once a week at most. And I will only spend like 10 minutes at most. So when you're derma rolling any plane, any face, you always want to go in the direction of a star. So that means up and down, side to side, diagonal, and diagonal. So that way you're covering the whole plane. Be very careful of bony areas. Obviously, you're gonna feel it a little bit more. It's gonna poke you a little bit more in bonier areas versus your cheeks or your stomach or something that has loose skin. But again, guys, this is just a little bit of info on what it is. I'm not encouraging you to do this at home at all. There are tons of YouTube videos that do. Me, as a professional for plastic surgery recovery, you need to find a professional to do your professional body derma rolling. You need to find a professional. I understand you can do it at home. I understand that. I get that. For your first couple treatments, find a professional and ask their advice as to what they think you should do as far as doing an at-home treatment. There's that. When you're using a derma roller, a lot of times they will tell you to use a hyaluronic acid serum or a vitamin C serum or whatever, right? So my skin is allergic to any acids. I can't use coconut oil on my skin because it makes me break out in red hives like I've been burned. I get acid burns from it. Hyaluronic acid does the same thing for my skin. It makes it worse, and then my skin takes a lot longer to heal. I use olive oil and vitamin C, a serum that I have with rose hips in it. Whatever serum you want to use is up to you. But again, this is why I'm saying contact a professional because they may have professional dermalogical serums for what you're doing. Don't just go buying shit on Amazon, guys. I say this all the time. Do not play Russian roulette with your body. Make sure you're doing this right. So they will tell you to use some sort of serum with it because one, microneedling helps the serum absorb a lot faster and a lot deeper. And two, it's going to help the skin repair a lot quicker. So you're going to want to use some sort of serum with it. But body derma rolling, I have literally seen people with like that puckering loose skin. And again, we have the pictures on our Instagram and the before and afters. I've seen people with that puckering patch of loose skin that it completely snaps back. I mean, I'm so not kidding, totally snaps right back immediately. I'm actually going to also post a YouTube video in the description of this, to a woman in the UK who used derma rolling at home for her body after kids, for her stomach, and you can literally see over the course of 6 months her skin is almost completely smooth, and she had like a lot. So when you're doing this, make sure you find a professional, number one. Number two, it freaking works like really, really, really well for doing new skin and like helping renew that. Number three, make sure you're doing it safe. Make sure you are not overdoing it. And again, it's a long-term game with this. It works. I'm promising you, it does like miracles for loose skin. I've seen amazing, amazing, amazing things. But it is a time sensitive thing. Whereas even something like Jade Plasma, right? Any skin tightening is going to take a while because you are telling your body to make new skin, to make new tissue. That's not a week. That's not 2 weeks. Even a tummy tuck takes 6 to 8 weeks to heal. So if a tummy tuck takes 6 to 8 weeks to heal, this is going to take a lot longer because it's not as hardcore and not as invasive and not as, all at once. Jade Plasma, same thing, takes 4 to 6 weeks for your skin to start really tightening up because you have to heal, and as your body's healing, it's making that new tissue and pulling everything back tighter. So there are ways to get your body to stimulate this growth and to make it work, but guys, you have to be patient. You have to keep going. Just like with any other serum you use, just like with any other, skin tightening creams or anything like that, your body's going to take some time to process that nutrients and get it absorbed. So skin tightening is a long-term game. And when you're doing it with a derma roller, I'm telling you, it works like I cannot. That's the reason I have one. I wouldn't be doing it if it didn't work. It works. But again, it's a long-term game. You have to be patient with it. You have to do your research. Like I say with everything a million times over and over, do your research. Find a professional. Find a professional. I'm going to say it one more time. I know I've said it a million times. Find a professional to do your derma rolling. And microneedling and all those kinds of things. But there are lots of options for skin tightening. This is the best one that I have found. I have tried the creams. I have seen all kinds of, Jade Plasma, machine things, rollers, all kinds of stuff. This literally, scientifically, is the best thing for your skin tightening. And this is coming from a post-op professional who deals with skin tightening all day long. So please, please, please check this out. It works. I hope this video was a little helpful. Again, I'm going to post that article with the directions to derma rolling in here so that you guys can do some research on it. I can post that video as well with the girl who did the body derma rolling for her stretch marks after kids. But again, guys, please find a professional. Like, find somebody in your area that does it. And that's it. And I hope this video helped. And I will see you guys soon. And definitely check this stuff out, guys, because it really works. Again, I wouldn't use it if it didn't work. It works a lot. All right, guys, have a good day. Bye.